For all of our trends reports, we're putting it out there to be actionable. So we cover a lot, and we also show different types of examples because at ACCC we know there's no one-size-fits-all solution.
That's Meagan O'Neill, ACCC's Executive Director. We'll hear more from her later in the show about the 2024 Trending Now in Cancer Care report. Plus, stick around until the end of the show for details on this month's ACCC's 41st National Oncology Conference. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Each year, ACCC produces a Trending Now in Cancer Care Delivery report. The report identifies current challenges as well as practical solutions to meet those challenges. Cancer centers also use the information to find opportunities to improve cancer care delivery and the patient experience. Walking us through the 2024 Trends in Cancer Care Delivery report is Meagan O'Neill, the Executive Director of ACCC.
So our trend report, it has evolved over the years. We used to issue an annual membership survey that really went into in-depth understanding and questions around the latest our members were experiencing, the hot topics or really the biggest issues here and now within cancer care. And so it would be a deep dive around your latest workforce challenges, what you're doing in community engagement, how you're setting up your care model or redesigning care model opportunities, the build of your comprehensive, robust clinical service line, and how research fits into that, all those different areas. We still use the trends report for commentary and insight sharing on all those topics, but it's pivoted from an annual survey as the basis to more of a interview format and anecdotal discussions that we have in real time at our conferences, largely our national conferences. And that is really just to respect that there, especially coming out of the pandemic, there was a lot of survey fatigue and the extra time it takes to fill out questionnaires. We wanted to get those insights in a way that was easier and took less time from our members.
What do you think sets ACCC apart?
At ACCC, we view ourselves as the how-to organization. We want to provide a how. So the what, there's other organizations, our partners in the space like ASCO, they'll tell you the what, the national guidelines. We like to focus on that how, and the how to looks different for different organizations. And so what that means for us is pushing out education and advocating on the issues that we know affect members broadly across the country in terms of cancer care delivery, but offering up different solutions and different considerations, strategies that we've seen effective at a comparable organization, and really helping to provide those tips and those case study examples and take the clinical advances and the latest and greatest in oncology science and research, translate that into how to implement that or operationalize those changes in the clinic and for the cancer care team.
What did this year's report reveal in terms of community outreach and engagement?
So Dr. Nadine Barrett, she is a leading voice nationwide in the community engagement and equity area, and reimagining community engagement and equity in cancer care is ACCC's president's theme for this year. We're hearing more and more questions about it from the field. I would say this is an area where there's a lot of cancer provider organizations that have not historically had many resources put into an outreach arm. There's many organizations I've seen where those resources are not in place today. And so it's helping communicate the understanding of where to start, what a really strong, robust outreach and engagement strategy can do for your organization. Mary Bird Perkins was highlighted in our trends report. They've long been a leader in this space and found really creative ways to work with their community in a way that is productive for the organization, but also generates philanthropy and funding to help further bolster the area of resources like this. And so they were highlighted as an example in our report, as were other leaders in this space, and I will continue to push that for the years to come.
And we can't talk about trends in cancer care without talking about AI. What is ACCC doing to help cancer programs and care teams navigate AI?
We have a multi-year plan that we are working to finalize now. And so really starting now, but knowing it's going to be much longer term in terms of understanding the different technologies that are available and really how to optimize those solutions in oncology. Where we're starting is with the here and now. So what's available today that has been proven to save time or reduce burnout or be an effective tool for better patient care, for better access. Those solutions are what we're focused on for this year and into 2025 so that we can help our members cut through the noise in this space, because while the innovation has been wonderful, it is very overwhelming for some of our members, smaller programs that have 50 different AI companies knocking at their door. And some of those solutions are not the ones that are going to be here in 5 years, maybe even in 3 years. It's really the tools that are cutting edge, that are interoperable, that are agnostic to the EHR, that don't have a tremendous investment cost, highlighting those and showcasing those examples with our members. So fortunately, some of our board leaders are really on the national forefront and the cutting edge side of oncology AI, and we're really able to leverage the connections there to understand the practical tools they've implemented in their clinic and pushing out the communication around how that benefits clinicians and the rest of the care team.
Prior authorization is always a big topic with members. How is ACCC helping members with challenges in prior authorization?
We have a long history of advocating on behalf of our members for prior authorization reform. Prior authorization for ACCC is still a policy priority for us, both nationally and at the state level. There's recently, in the past year or two, there's been more activity going on at the state level within certain states, but we've started to see a little bit of this get chipped away at and some progress made at the national level as well. And so the recent regulation that CMS issued will help to streamline the prior authorization process. It's a step in the right direction, but in practice, there were two major gaps that we continue to advocate on, and that's helping to look for reform or a policy to really get this plaguing issue under control with our providers on the commercial side. So that's the commercial payers side of it. That was obviously not part of the CMS regulation. And so that remains a gap. And then drug approvals is the second one, that it's one of the biggest challenges right now and really hitting very hard in oncology, the amount of denials or in prior authorization burden that is created within the specialty pharmacy and innovative therapeutic space. So it's enormously important, but still a must-address issue that wasn't part of the recent CMS regulation. Drugs were carved out of that.
How big of an issue is this for members?
It's a huge issue, and it has been for years. And the reform and a new policy to address prior authorization and the denials, it's needed now more than ever. There's actually been an increase, an uptick in the amount of prior authorization we've seen within our member organizations. It used to be, even a year ago, we weren't seeing as much for the supportive care drugs. Now it's not just for the newer therapeutics that are coming out into the market. They are high cost drugs. Across the board, we're just seeing prior authorizations on most oncology treatments and also on the oncology supportive care side. So it's a very big issue because that all takes so much time, and it creates this additional burden for our cancer care team members. And if you look at the impact on patient care, that's really where the conversation needs to be focused, because there is a significant and detrimental impact on patient care. Different studies have shown, and we spoke to it in our trends report as well, that 90% plus of providers report that patient care was impacted through a payer authorization or payer challenges or prior authorization denials. And so it really is delaying care. It's creating access issues to the latest and greatest therapeutics that are proven to be the most effective. It's widening the equity gap. And so we'll continue to push for reform in this space.
What did this year's report say about clinical trial diversity right now in cancer care?
Clinical trials diversity, this is an area where we are working closely with other oncology associations to bring attention to the need to both expand clinical trials more into the community setting. 80% of cancer care is provided in the community. And so really the science and the research that is housed at our academic institutions, pushing that out more broadly and specifically to areas or to patient populations that have a long history of being underserved or underrepresented. And so it's both the expansion of the clinical trials, the new therapeutics that are coming out and are showing fantastic results in many disease areas, but also ensuring that the clinical research population we have is diverse and is reflective of what the country looks like today and what that organization is, what their real community looks like, including the pockets that they historically have not touched as much.
How do you hope ACCC members use the trend report?
For all of our trends reports, we're putting it out there to be actionable. So we cover a lot and we also show different types of examples because at ACCC we know there's no one size fits all solution. And there's a very wide spectrum of where people are at on certain issues, like AI. I mean, we've seen it adopted and really effectively being used in some community practices, and others, it's more of that scary thing that's out there for the future that hasn't been touched and it probably isn't even very much understood at this point yet. And so at ACCC, we think all of those realities, we see it all, and it really try to meet our members where they're at and help them get started and then advance or progress as they develop their new programming or push out these more innovative offerings.
Thank you, Meagan. You can head to the show notes for a link to this year's report. And if you found this useful, we hope you keep the conversation going by sharing this episode with your colleagues. Next week, Cancer Buzz will be reporting live from the ACCC 41st National Oncology Conference in Minneapolis. That conference will feature innovators in healthcare like Maria Hernandez.
I think that there's always room to grow and improve because we've been talking about health equity in the U.S. for over 100 years. But it really took the pandemic and the murder of George Floyd and several other events in our recent past to really open everyone's eyes to see that this is an issue we must address.
Keep your eye on this channel next week for more from the NOC. Until then, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.